the hips of our golfers. Sometimes it's because people, you know, they're sitting all day at their jobs, they're sitting at work, and those hip flexors or the muscles in the front of the hips get shortened or get tight because they're in this flexed position all day from sitting. Other times we see that people have been in kind of that S posture, that poor posture that we see, and those hip flexors get really tight as well. So we want to give an exercise that can actually help to lengthen those or improve the flexibility of their hip flexors, something that they can do on their own at home or after that we've done some soft tissue work or some mobilization of the hip to get some more mobility. So in this position, Chloe's going to be in a half kneeling position. Left knee down, yep. And so we're actually going to mobilize the left hip in this exercise. We're going to use a CLX band, and I like a heavier resistance band for this so we get a lot of pull. So the gold band is actually a nice option for this, the heavier resistance. From here, we're going to loop it kind of right around her upper thigh, right around her rear end. And we can hold it, or we can actually attach it to something if she's at home and she doesn't have anyone to help her. From here, the band is actually pulling her hip anteriorly, or pull to stretch that anterior hip capsule. She's going to feel it stretching in the front of her left hip, so in her hip flexor. If she wants even more of a stretch, she can raise her left arm up overhead and kind of lean back with it. And she's going to feel that it's stretching again and through the front of that left hip, the left anterior thigh. If we want to make the stretch a little bit more lateral, now she can lean to her right, still with the arm overhead. And so again, we're still getting that stretch of the hip joint. This is mobilizing, pulling her hip anteriorly, stretching that hip capsule, as well as the surrounding soft tissue about the hip. A great way to stretch your hip flexors at home and really to counteract the effects of sitting.